Okay, this video is called How Can Big University Neuroradiology and Body Imaging Help You? And so what this is about is I recently attended some big university review courses on imaging radiology and of the brain, the head, the neck, the spine, and the abdomen. And so how does this benefit you? Well, there is one major difference between the big universities and most other hospitals. And here's the big difference. They have much higher volume. They probably have typically 5 or more times more volume than a smaller hospital. And what that means is they're going to see rare diseases more often. Also, because of their volume, they have an economy of scale, so they can hire a lot more hyper-specialized doctors. And rare diseases will get referred to them. So one of these really big universities, like the Mayo Clinic, for example, they're sort of famous for taking care of something called SIH, and that stands for, here, I'll make myself a little bigger here. That stands for spontaneous intracranial hypotension, which is a rare disease whereby you can get a tear in the dural sac around the thoracic spinal canal, for example, and you're leaking cerebral spinal fluid out of it, which lowers the pressure, the intracranial pressure, because you're leaking CSF, cerebral spinal fluid. You know, in a regular hospital, regular size hospital, you're going to see about one case once every 5 years, okay? Maybe once every 10 years, all right? At the Mayo Clinic, they're going to be seeing lots of those cases. I don't know their exact volume, but because they get them referred from, all over the Midwest, the regional states, they're probably seeing, I'm just going to guess, I don't know the number, but off the top of my head, I would guess many, many, many times. Let's say 30, 40 a year. I don't know the amount, but it's going to be a huge amount. All right. So they get good at it. They get good at diagnosing a really rare disease, and they've got some good procedural doctors that are good at treating it. They know how to do all these special variations on the myelograms and special variations on the blood patches. So that's impressive. So what I'm trying to say is, if you think you have a rare disease, no one can diagnose it, I would say you should go to one of these really big hospitals like the Mayo Clinic or some other specialty center, because they're more likely to have experience with it. So that is their one big advantage. And my hat's off to them. I was kind of amazed at how hyper-specialized some of their doctors are that go into all the subtle nuance of really rare diseases like this. So that is a great benefit to society for persons with those rare diseases. But rare diseases are really rare. The classic medical saying is, when you hear hoofbeats, think of horses, And then a rare disease is like a zebra, and a really, really rare disease is like an okapi. Okay, so what I'm trying to say, though, is, 99% of people, they got the common diseases: hypertension, diabetes, obesity, atherosclerosis, coronary artery disease, gastroesophageal reflux disease, impotence, renal insufficiency. I see that stuff all day long, endlessly. Okay, and also these big famous places, well, how good are they at the common diseases? And I got news here, they stink. They just basically, echo the textbook, okay? Just nonsense. Like the guy talking about dementia, he starts spouting off all this stuff about Alzheimer's disease, which, by the way, I think Alzheimer's disease is a joke. If you read about it, you're going to go, oh, Alzheimer's is the most common cause of dementia. Yeah, right. Based on what? What's the clinical historical finding to diagnose Alzheimer's? There is none, okay? What's the physical exam finding to diagnose Alzheimer's? There is none. Okay, what's the reliable finding on brain MRI or brain CT? There really isn't any good reliable finding. They'll say theoretically, increased atrophy focal in the medial temporal lobe and the parietals, but you seldom see that, and it's often subtle, questionable that you're really seeing it. And what about nuclear med imaging? Supposedly that's a little better. I'm not so sure. The guys who do autopsies on their brains say they can't even tell, and that's part of that, post hoc, add-on of cognitive reserve theory coming out of the Notre Dame nun study on Mankato, Minnesota, whereby the nuns who were more academic, studious, like to teach, like to write and read, they would have a lot of senile plaques, supposedly characteristic of Alzheimer's, but intact cognitive function. And what I'm saying is that whole cognitive reserve thing, some of that seems like it's just a way to try to keep that beta amyloid senile plaque theory intact. They can't even diagnose it that well with certainty at autopsy. They don't even have a treatment for it. I mean, doesn't that sound like BS? You can't diagnose it, you can't treat it, so why do you say it's real? Just because somebody's making money off it with a drug? When there's a lot of really good dementia theories, as we talked about before, the dilatory mouse equivalent theory, the Rogers neurovascular uncoupling theory, and the Douglas Kell and Etheresia praetorius mechanism of prothrombotic postprandial dormant bacteria reactivation with iron. We talked about all this stuff before. So anyways, what I'm trying to say is the big universities, I thought they really were pathetic and they stink, as you would expect, in all the common stuff. But man, they were really good on the rare stuff at diagnosing it. And a lot of times there is no treatment, but at least you know what the person has. And they sometimes were pretty good at treating some of these really rare diseases, because a specialist who sees a lot of these cases will get more experience with them. Somebody else, sees it once every 10 years. They're not going to have experience with it. So what else did I get out of this? Oh, the old joke when I was a medical student was neurology has 1,000 pages of diagnosis in their textbook, but only 1 page of treatment, and it just says post-stroke patients, give them an aspirin, okay? And what I'm trying to say is it's a little bit similar with internal medicine and psychiatry. They've got a lot of treatments, but the treatments don't work so well, okay? They almost never cure anybody for the common diseases. So, the only way we've kind of talked about that before is low-fat vegan. So the bottom line is if you have a really rare disease, no one can diagnose it, then, good idea, go to a big university, try to find a specialist, and, maybe they can help you. They can at least diagnose it. But for all the other common stuff, I didn't get the impression they had anything to offer.